cupping can be really beneficial for conditions such as plantar fasciitis, but you're going to need a smaller cup for these areas, as obviously we are working on a smaller area of the body, and again we've got quite a few contours going on. So with regards cupping for this area, what I personally would do is the first point would be on the heel itself. So I'd come in and place the cup on and then pull through. Now these areas can be quite tough, and you may need to put a couple of pumps on there to make sure that you're getting a good lift and for it to stay in place. Second one may be directly into the middle of the foot. This is usually an easier area to do. Again, placing it on the foot and putting a couple of pumps through there. I did one and just didn't quite feel that we got enough pressure, hence why I've done another one. Always start with the one and feel what it feels like pressure wise before you put any more on. So that's the two areas I would do in terms of stationary cupping. You could put another one in here if you wanted to, so you could put 3 on. Ultimately you want to try and work through that fascial line as much as possible, but these are the areas that you're wanting to work. So if you were going to go here, here and here, would be quite a nice one, but again when you're starting to put multiple cups on, you've got to be mindful that it's going to start adding pressure through that soft tissue, which then will start to pull the pressure out of the cups as well. So you may find if the foot is quite tight that you may just want to go with two cups rather than 3. I'm just going to place one here. Because the heel on my patient is quite tight, I don't feel I could possibly get away with having 3 on Laura, but you can see where I've placed the cups should you wish to put 2 or 3 on your own patients. So that's how we would do it for stationary cupping. In terms of massage, as we would with any other area of the body, of course we're going to use the massage medium that you wish to use. Just going to place a little bit of massage oil, massage wax just through that area, loosen it off. Obviously at this point you would have already done a massage to this area, so I'm just placing a bit of lubricant on the area to be able to move the cups across the skin and have a feel, a palpate of the area to see where I'd want to work. From there we're going to place the cup on as much as you can without hurting the patient, and again I'm now going to support the foot, create a bit of tension through the bottom of the foot, but also to stop the foot from wiggling. I'm just going to support just there, and then I'm going to move the cup backwards and forwards like so, working through those soft tissues. And of course we can go laterally, or we could go longitudinal. There we go. Of course, all these techniques really does depend on what it is that you're trying to achieve. Are you trying to loosen off the area, or are you trying to calm down the area? If it's really tender from something like plantar fasciitis, you might find doing massage through that area quite tender. So in that case, you might find that you're just going to stick with stationary cupping. You could do a little bit of a pin and stretch, so if there was a particular area that was tight, again we could put the cup over that area. There we go. And then we're going to try and lift and stretch through the bottom of the foot. But as you can see, if the area is really tight, it's just going to pop pop the cup right off. So you have to work on whether your patient is suitable for that technique. But if the cup was to stay in place and you were able to get enough tension and create more tension through the area, this is ultimately what we're trying to do. We're trying to bring the foot into that dorsiflexion, keeping the cups in place. You might find other cups more suitable for this technique, as the suction cups sometimes do lose the suction through these tighter areas, but not impossible, and all depends on the patient.